Wikidonus.com. Truth about tooth.
Most people think that they lose their teeth when they become old. Most people think that it is okay to lose a tooth, or a tooth becomes a little bit loose, and if it falls off, it is okay once you reach a age of 60 or 70. It is not like that. The tooth has to be there until you die. Do you think that it is right to say like that? Yes. People who are aged doesn't have to lose their tooth. The tooth is given by God so that you can eat well, chew well, and have good digestion, because the first part of digestion happens from the tooth. So why do we lose tooth? Why the tooth becomes shaky? This is the topic which we are going to talk. Why is it becoming shaky? And also, if it becomes shaky, what to do? Shall you go to a dentist and take it off, or wait for it to become more loose and loose so that it can fall off? What has to be done? What are the treatments, and how you can get a better teeth, and how to not to get a shaky teeth when you become older or get into some trouble. So it's all about gums now. I've been talking about smile designing in the previous episodes. We talked about gum visibility last episode. So we have gone into the pink part of the tooth and the dentistry, that is the gum issues. And today we will speak all about shaky teeth. Why is it part of the gum treatments? Most of the shaky teeth is happening because there is a carelessness. Most of the dentists would have told you to go to them and do the cleaning on a 6-month priority or a yearly priority at least. Nobody would have thought about it because there was no pain, there was no issues at all, there is no shaky teeth, or there is nothing, no problem. So you kept on delaying it. Then suddenly one day what happened is there is a small flake of the tooth which just comes off, and then you thought that it is some tooth which is broken. No, it is not tooth which is broken. Most of the time it is a calculus which is attached onto the tooth which just came off. Then you go to a dentist, and then the dentist says that we will have to clean it professionally, and once you clean it you find that all the teeth are loose. Have you seen that? Have you been on that area? It is not the dentist who has done the damage. It is you who have not gone to the cleaning has done the damage, because your whatever debris became calcified and was attached to the tooth was holding the tooth there, and the gums which should have hold the tooth along with the bone has gone down. Now you don't have the bone, you don't have the gums, and the tooth has started shaking. So how should we avoid it? So you should go for a checkup once a year at least to a dentist to see whether your gums are good. If you have a bleeding in your gums, please make sure that you go to a dentist and get the treatment done so that the gums are not receded off, or the gums doesn't come out. The major reason why the gums fall back is actually a plaque or calculus, as you say. The second reason may be a traumatic issue, that is a tooth which is not biting properly, a tooth which is ill placed and it is biting onto the tooth, or there is a force which is there even more than what it should be, or you have lost some teeth on the back so that you are biting on very few teeth. Some people will have around 16 teeth, some people will have around 20 teeth which are there. They think that I have still 20 teeth, but maybe only 6 are in use. So what happens is the 6 are in use. Why? Because there are 6 teeth in the upper and there are another 14 in the lower, but only 6 can have a opposite or a counterpart. So only 6 are in use, although there are other teeth in the mouth, but it is not in use. So what happens there is actually there is reduction in use of that tooth itself. So what happens, that area becomes, we always tell it is disuse atrophy. Disuse atrophy means it is not used at all. So what happens, you see, if you break your arm, what happens is you go to a doctor, then they will put a plaster onto it. After putting the plaster, you might have seen, then they will give you a splint so that you don't move the arms. After some time, what happens is you can put a small stick and scratch and things like that, right? Have you experienced it? Yes, because when the doctor has put the plaster on it, it was so tight because it should not have moved. Then what happens is actually the space is involved because your muscles have gone down. Just like that, since you are not using the teeth, what happens is the gums also become weak. There is no force on it because there is no need of the gums because it is not being used. So what happens is the stimulation of the gums is not there. So if you have some teeth which are lost, the opposing teeth will become shaky. So what you need to do in such cases is actually to replace the opposing teeth so that this tooth doesn't become shaky. The opposing teeth doesn't become shaky because then you are giving some stimuli to it so that the gums and the things, just like doing exercise, because if you want the muscles to be strong, you have to do exercise. If you want the tooth to be strong, then you need a stimuli, or you need to chew on the tooth, then it will become strong. Otherwise the bone will slowly shrink and then it will fall off. So that is one of the reasons why it can fall off. The third reasons why it can fall off is a misuse atrophy. When I tell it is misuse atrophy, what happens is basically you might have opened a can of your favorite beer or something like that. You wanted to show off, you have a beer bottle opener, but you wanted to do it with your teeth. Then what happens is you might have exerted a lot of pressure onto that tooth, or you might have one tooth which is standing outside and you might be chewing onto the tooth without your knowledge itself. So that will give you a lot of force concentrated on that tooth itself, then also you can lose that tooth. It becomes shaky and then it goes. So traumatic occlusion, or not using the tooth, or even using the tooth really on one tooth, there is a concentration of forces on one tooth, can actually cause the tooth to become shaky. All these things needs a treatment, right? So we will talk about the treatment in the next video. Please make sure that you follow it up in the next video. The next video will come soon. So please subscribe, please send this to your friends and family and things like that who have a gum problem, or even if you don't have, let them know that they will not get into some trouble. So for the treatment video, wait, and then comes the treatment for the shaky teeth. Thank you very much. Have a great day. Dr. Thomas Nechupadam from Nechupadam Dental.
Wikidonist.com